Patients are complaining of being treated badly by healthcare workers at some clinics in the Eastern Cape, and this has been flagged as a concern. This and other issues are in the spotlight in the latest report by community-led clinic monitoring group Richidze Positively. Now, the report reveals that several improvements in the quality of services over the last year. For more on this, we are joined by Anele Yawa from the Treatment Action Campaign. Anele, a pleasure to have you on the program this afternoon. Now, oftentimes we hear or even get reports of the ill treatment of patients at some of our public healthcare facilities. What effect does poor treatment have on people who are receiving treatment, and can this even deter them from seeking treatment?
Greetings to you, Nhlanhla, and greetings to the viewers at home. And thank you for having us. The question that you are asking is very important, Nhlanhla, more especially in a country that has committed itself to positively work on the response to HIV, TB, and other chronic illnesses. So, the question we must ask ourselves, Nhlanhla, is, and everybody, what makes the majority of people living with HIV, as well as the public healthcare users in general, to disengage from our public healthcare facilities? This includes key populations. I'm talking about sex workers, the LGBTQI community, MSM, people who are using drugs. Why are these people feeling not comfortable to engage in terms of accessing healthcare services within our public healthcare? On a number of occasions, it is reported that people are still experiencing stigma and stigmatization within our public healthcare institutions from some of the healthcare providers. And also, this does not only speak to people living with HIV, it speaks to key populations, as I've said, where the status of other people living with HIV is being disclosed without their consent, where people, because of their sexual orientation, are being ridiculed and mocked within our healthcare facilities when they go there to access healthcare services, which makes majority of people living with HIV and key populations not to feel comfortable to access healthcare services within our healthcare facilities because of this attitude, right, which they get from some of the healthcare workers.
So according to the Richidze data, it also reveals that of the more than 2,400 people who were interviewed, only about 55% thought that clinic staff were always friendly and professional in the way that they carried out their work in the Eastern Cape. And this, of course, is down from 63% last year. Now, this poor treatment is off-putting, to say the least. How do you suggest that health authorities can even address this issue? I mean, it's quite worrying that people miss appointments or even stop going to the clinic altogether, some even reporting being terrified at what awaits them at these facilities.
Couple of things that needs to be done by the authorities, including our government. One, if a person misses his or her appointment, when that person goes the following day, those people must not be made to go at the back of the queue, because that is not a standard operating procedure of the department. Two, when people disengage, default on their treatment, when they go back to the facility, they must not be shouted at. They must be welcomed with open arms. Three, when people relocate from one area to the other and they go to the nearest facility, they must not be asked to produce referral letters because they don't have them. Because what is important here is not a referral letter more than providing healthcare services to a person. Three, let's cap this problem of messy filing system as well as missing files.
So these
and then
yeah, you can go
five,
ahead.
let's make sure that we all work together on how we sensitize the healthcare providers. One, to respect the constitutional rights of the citizens of the country, and two, to respect the Patients' Health Rights Charter. By doing so, we will also cap a situation that we have experienced in areas like Nelson Mandela Metro, around NU11, where a patient was ill-treated by a nurse at a clinic. A patient went back home to fetch a firearm, and then the patient chased a nurse, and as the result of that, a clinic ended up being closed. Nurses and everybody who is a healthcare provider must begin to understand that health is a fundamental human right, and they are not doing a favor by providing healthcare services to the people of our country.
In extension to that, I mean, poor staff attitudes are among 11 key issues that were actually outlined in this second edition of the new Richiza State of Health report. Would you say this may also point to healthcare staff who themselves are very frustrated or even overwhelmed by the poor conditions that they often have to work in?
Yes, we pledge solidarity with healthcare workers as well as their unions at all times, because we believe that without healthcare workers who are adequately paid and who are working in good working conditions, and on top of that who are not understaffed, we can provide quality healthcare services in our country. On top of that, healthcare workers and their unions must begin to respect the constitutional rights of the healthcare users. As much as we respect their right to picket and right to do this, when healthcare workers have disputes with the employer, which is the department, we do not wish to see them disrupting healthcare services. We wish to see them and we wish to join them when they disrupt services in the offices of those who take decisions that affects both the users and the provider. So we are saying as TAC to healthcare workers, let's stop disrupting healthcare services to the needy communities. Let's go, let's mobilize, let's organize. Let's go and disrupt services in the offices of the district chief directors, of the HODs, in order for the HODs to be able to bring about the change that will benefit both the users and the providers, instead of the unions as well as the healthcare workers disrupting health services that will, at the end of the day, compromise the public.
Another major problem is the long waiting times at some of these facilities, and mostly in rural areas. This also forces people to even begin queuing very early in the morning in this attempt to get to be seen more quickly. Yet about 45% of people who are reported feel very unsafe or feel that they might be or susceptible to crime as well. What have your observations been in this regard?
So, one of the recommendations that we are bringing forward to the Department of Health of the Eastern Cape to try and cap the situation that you have described. One, let's work together to make sure that all those people who are stable on their treatment are decanted. It therefore means there must be pick-up points nearer to where they stay, where they will just go and collect their medication instead of queuing in clinics. That is step number one. Step number two, we are saying people living with HIV, instead of being given a 2-month supply of treatment, let them be given a 3 to 6 month supply. It therefore means people living with HIV and other chronic illnesses will only go twice to a clinic. Therefore, it means we are fighting the congestion within our clinics. But also, on top of that, the other thing that we're talking about that the department must fix, if me and you, when we are having an account in any bank in South Africa, we are able to access our money through any ATM anywhere in the country, why that not is happening within the department? That's why we are talking about the government fixing the filing system, but also fix a system that will stop a situation where the public healthcare users, when they relocate from one area to the other and want to access healthcare services to the nearest clinic, where they are often asked to produce a referral letter. What we are asking for the department is to fix the system so that I can go to any healthcare facility in the country. All what they do, they punch my ID number or whatever system they have, and then they will get my medical file, because on number of occasions, we have seen in number of clinics in our country, as well as in Eastern Cape, where medical files of the patients gets missing within the healthcare facility. It therefore means the medical record of that patient is also missing. So to cap that, let us digitalize everything, and then let us fix all these issues that we have raised, including sensitizing our healthcare workers in order for them to have a decent way to talk to the public healthcare users.
Anele, thank you very much for your time. That's Anele Yawa from the Treatment Action Campaign. Of course, they're speaking about the poor treatment that patients have been complaining about at some facilities.